Who would have thought our canine companions could catch the flu, just like you and me? But it's happening, and more than 1,000 cases have been reported in the state this year. Coming up on the Paw Report, we're joined by Greg Reilly of the Honey Creek Animal Hospital in Terre Haute to talk about canine flu and another medical condition caused by cats. Stay with us. Production of the Paw Report is brought to you by
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
Okaw Vet Clinic in Tuscola and Dr. Sally Foote remind you to properly take care of your pets and are happy to help support the Paw Report on WEIU. Okaw Vet Clinic located at 140 West Sale Street in downtown Tuscola. More information available at okawvetclinic.com.
Thanks for joining us for this episode of the Paw Report. We're joined today by Moppet, and I'm sure you can guess which one is Moppet, and Greg Reilly of the Honey Creek Animal Hospital over in Terre Haute, Indiana. So we're glad that we've got a Terre Haute connection over here in Charleston. So thank you for making the journey with Moppet and
thank you for having
joining us for this episode. Good topic we're going to talk about today. A lot of people are talking about it. But first, tell me about yourself and this little guy you've got on your lap. Little girl, I should say.
Little girl, this is Moppet. She is a Brussels Griffon, and I would say she's maybe about 4 to 5 years old. She's an absolutely wonderful stinker. Over at Terre Haute, there is a morning show that I'll help out once a month, and basically she's my prop dog, more or less.
Little diva, huh?
Very much of a diva, very much so.
What is the breed again? I'm not sure that I've had dogs all my life. I'm not so sure that I've heard of this breed.
She is in the toy group, if someone who's following, like, say, the Westminster show, and she is called a Brussels Griffon, which sounds really highfalutin, but, you know, she's something else.
She's been running around the studio here making herself quite at home today. Tell us about yourself and your background.
Oh, wow. Well, originally I'm from Alexandria, Virginia, maybe about 5 miles away from Washington, D.C. if there's no traffic. Emphasis on no traffic. I came out to Indiana with my wife, and I would say it's been a pretty good decision. So I would say I've known you since 2001.
Yes, we've known each other a long time.
Long time, yes.
And you've been at the same animal clinic for many, many years doing a lot of different things.
A little over 20 years now. We're coming up on 21 years now. So, yeah.
Well, we're glad you've joined us today. Time does fly. We're glad you've joined us. And we've seen a lot of stories, a lot of talk. We've heard a lot of things about canine flu, which is, well, I'll ask you, what is canine flu?
It's a little bit of a confusing situation right now with canine flu, only because it is 2 strains of canine flu, okay? So the first time that we actually came into knowing about canine flu, I would say was back in 2004 to 2006, okay? Now, if you look at the CDC report, that strain of flu is called the HNN8, okay? And basically, that kind of strain of flu, that's the equine strain of flu that has mutated, that is able to affect dogs. It first appeared in Florida back in 2004 again, right around where the greyhounds are racing and so forth. There have been a couple other instances, say up in New York, okay? Why I say it's confusing is because that strain of flu, believe it or not, can be treated or prevented with a vaccination for it, okay? The current flu that's making all the big headlines right now and is grabbing all the media, that is the H8N2, pardon me, the H3N2, okay? And that's out of Chicago, and there's no preparation for it or no vaccine for it to prevent it. If your dog does come down with it, there's various treatments to take care of it, but there's no way of preventing it. It's going to be the N8, which is the equine version down in Florida. That's the one that everyone is clamoring for the vaccine.
How did it get to Chicago?
You know, that's a really good question because I think there's various forms of a hypothesis, and I should probably clarify that the N2, I'll just shortly abbreviate it, the N2 is an avian form of the canine influenza, and that mutated from avians to canines. And what a lot of people are really concerned is whether or not that kind of flu can mutate and infect humans. Right now, it cannot. It came from China, right around South Asia, and then somehow it made it over where, you know, to the United States, maybe possibly from California, and then jumped over to Chicago. There's been some people that have kind of talked about that possibly maybe some rescue groups that was rescuing some dogs from China. They didn't realize that the dog was infected with the influenza, and yes, I know, pay attention to me, somehow got over to Chicago that way.
So the magic question is, how can my dog catch the virus? I mean, how is it contracted?
Well, let's say Moppet has the virus, okay? The way it's contracted is that Moppet will be sneezing or coughing, okay? And the virus will spread onto a surface or to some piece of clothing. And what that's called is fomites. So if I had my stethoscope with me, and let's say I'm bringing it down to check out Moppet, Moppet sneezes on my stethoscope as I'm listening to her heart, okay? And if I remove it, and if I don't clean off my stethoscope, let's say I go see another dog, your dog, and I'm doing this to her chest, the fomites, if she sniffs my stethoscope, the virus will hop on from the stethoscope onto her, more or less, kind of in a roundabout way.
So has your clinic seen any cases in Terre Haute?
No.
Do you have to take special precautions? I mean, in your office to make sure that just what that little scenario that you talked about, you know, to just in case. I mean, if you get an animal that maybe isn't one of your regular clients, what if somebody has an emergency and they just took a trip to Chicago or somewhere else and they rush into your office? Can you help?
Absolutely, right. You know, the biggest thing that you have to do is make sure that the clinic or your boarding facility or your shelter facility gets really properly cleaned. Bleach does a wonderful job of getting rid of the viruses, and there's a lot of cleaning products that will also do the same thing.
What are the general symptoms of the canine flu?
One is going to be lethargy, sneezing, coughing, weight loss, lack of appetite, no energy whatsoever. Those are usually your big telltale signs that, you know, there's something going on with your dog. But mostly the sneezing and the coughing will be the big telltale signs.
How serious, let's say Moppet goes in, is checked, and there's discovery, and maybe you can go through the testing process to see how a dog, if they, you know, what you do or what you would do if an animal comes into your office. I know Moppet.
Right.
Talk about the identification and you know, treatment options.
If left untreated, it could certainly progress into, like, say, pneumonia, and that could be pretty serious and unfortunately can be fatal. With proper treatment of antibiotics and fluids, you're basically just supporting the dog more or less. If you catch it in time, it should be relatively okay. Those are usually the big things that you're going to want to be taking care of. Moppet has distracted me horribly here. I'm sorry.
That's all right. She wants the attention.
She does want the
attention. She knows we're talking about her.
Yes, right.
So going back to, and I think you mentioned it, it is treatable.
Treatable.
But it could also be fatal.
Correct, if left untreated.
And that's, again, if coughing, wheezing,
Correct.
dripping,
Right.
you know, I mean, nasal drippage or any of sort of that thing. Now, much like humans, we have the ability to get a vaccine.
Correct.
You know, every year,
Right.
I'm pretty, I stay on top of it. I get a flu shot. Is that something that we can get for our four-legged friends?
Certainly, but you have to understand that, again, that there's two forms of the virus. It's the equine virus of the H3N8. That's going to be your flu shot, so to speak. The one that's coming out of Chicago is the avian version, and there's no flu shot for that. Basically, if your dog does come down with the flu, it is treatable with supportive care.
Is it is the treatment and care different for different breeds? You know, this is a toy breed,
Right.
little dog.
Right.
If I had a Great Dane or Saint Bernard or something of that nature, is it all different?
No, not really. Basically, what I would be doing with Moppet is that I would be placing an IV catheter into one of her legs, and we'll be giving her fluids through IV that would keep her, hydrated more or less, and then probably some antibiotics, and maybe if she starts getting some problems with her lungs where she's getting some fluid, maybe some diuretics like Lasix or something like that. Once that is established, it usually will run its course through about 7 to 10 days. Once that period is over, she should be fine.
Is there fever involved? Can you tell if your dog has fever? I mean,
It
are
does have a fever.
are there some checks that you could do at home? Somebody that, like myself, that's not trained.
Right.
Can you check those sort of things?
That's a very good question, and I should have probably mentioned that fever is involved with some of the problems like, say, sneezing, coughing, and so forth. The best way to check to see if your dog does have a fever is, unfortunately, is to get a rectal thermometer. Moppet would not stay there very long with this little piece of, plastic underneath
Right.
her tongue for very long. A normal temperature for a dog or a cat is going to be 101.5. If you get like right around about 102.5, that's usually a good indication that your dog is not feeling very well and probably has a fever.
And I've heard ears too. Do ears have anything to do with it, or is that an old wives' tale?
An old wives' tale. Same with the nose. If the nose is
Yeah,
warm and hot,
exactly.
If
That
you
was
feel
the other
Moppet,
one.
it's warm right now. So I would be saying, oh my goodness, she's got a fever. If she doesn't have a fever, she's fine.
Right. Are certain dogs more prone to getting or contracting the virus? Is it certain breeds, maybe different immune systems, small breeds, large breeds? Does that play into this at all?
I wouldn't think so, but you can also probably make the hypothesis that maybe Moppet may be a little bit more susceptible to it just because of her nose. She doesn't really have a nose. She's got something called a brachiocephalic skull, which is just really a short pug-like nose. She may be a little bit more prone to picking up viruses as opposed to, say, like a Great Dane or a Golden Retriever or a Dachshund, where they have that really long shaped nose.
What can you say, because it seems like the cases are spawned when there are multiple dogs together. So what advice could you give to maybe those that have multiple dogs in their households, or people that foster dogs that have multiple dogs at one time?
Basically what I would recommend, is to be careful. Certainly if you go to, like, say, a dog park, or if you take your dog to like a dog show or something along those lines, if you see a dog with those symptoms, you may want to remove your dog and yourself from that area, just because you can still transmit the flu through fomites to your dog, more or less.
How long before the onset of symptoms would take effect? So I go to a dog park, my dog's kenneled somewhere, my dog plays with other dogs. When am I going to know? I mean, before the virus gets onto my pet and symptoms start to show, and then how long should I let the symptoms progress before I say we need to go to the vet?
Right. I think each case is going to be different in terms of, how long that virus is going to attach the dog, and the dog will come down with symptoms. There'll be some dogs that'll be a little bit immune to it, and that will be fighting the virus a little bit longer than, say, like an older dog that may, say, have diabetes or something like that, or something that's going to compromise its health. In terms of how long you should wait until you take it to a vet, if it's sneezing, if it's coughing, not wanting to eat, I would say within 24 hours. I probably would take it to a veterinarian and have it checked out.
Okay. We've talked a lot about canine flu, and we're going to switch gears a little bit, not necessarily because there are stories in the news. But after doing some research and reading on this, I was actually fascinated by this next topic, and we're going to switch gears and talk about cat scratch
Yes.
disease.
Yes.
It's not the song that we all probably have rocked out to,
Right.
but there is an actual disease. So
There is an actual
define
disease.
it. What is cat scratch disease?
Cat scratch disease is a bacteria that cats have. They don't really will show any symptoms per se unless they are older. They can become ill, but they can be carriers of this bacteria that can more or less get into our bloodstream either through a scratch or through a bite.
So again, what causes this disease?
Strangely enough, it's caused by fleas or flea dirt, and that bacteria is called Bartonella henselae, or pardon me, henselae. And that bacteria, let's say you have a kitten, and kittens are great for being carriers of this disease. A kitten will come down with, say, fleas, it'll scratch itself, it'll have flea dirt underneath its nails, and then kittens like to bite. So what they'll do is they'll bite you and they'll be scratching on you and so forth. And that's how the bacteria gets underneath your skin into your bloodstream. And that's when you could have a lot of problems.
Let's say I have a cat that had a flea problem.
Good.
Can I bring it into your office, and is there tests that can be done to see if they're a carrier of this?
No, not really.
Really?
No, not really. Yeah, which can be a little bit alarming, especially if someone is completely unaware and they think their cat is perfectly fine. Let's say there's a person that's playing with the cat accidentally bites the person while it's playing. The bacteria gets into the bloodstream. The person goes to the doctor and says, I don't know what's going on. I've got these lesions on me. I'm feeling really feverish. I'm feeling really tired. I haven't ate. I'm losing weight. And the veterinarian, the doctor, if the physician doesn't know that the person has a cat, he may not think about, cat scratch fever.
What are the symptoms? You just mentioned some of them, but what are some of if I'm scratched or I'm, I have a kitten and I'm, they nibble at you.
Right.
What are symptoms?
The usual symptoms will be like, say, raised lesions on your skin. Unfortunately, sometimes you'll have some oozing of pus what could be coming out. It usually will attack your lymph nodes or closest to the wound, so it'll be like right underneath your armpits if you feel a swelling there. Obviously feverish, lack of energy, any of those, descriptions that I just said, you should really definitely go to your doctor as quickly as possible.
How is it treated?
Well, pretty hardcore. A lot of antibiotics, a lot of IV antibiotics. You may unfortunately be hospitalized and so forth. So probably if you do have a kitten, I'm certainly not going to be one saying, don't have cats in your house or anything like that. But if your cat does scratch you, the first thing that you should really do is make sure you wash it out with some soap and some running water. An ounce of prevention definitely will take you a long way.
Mm-hmm. And prognosis. So let's say that I have scratches. They were diagnosed as that. What is prognosis for me?
Well, obviously, if you get into the doctor pretty quickly and you get some antibiotics, you should be able to be okay. If you let it go for a while and if it can progress pretty quickly, certainly your internal organs be affected, your heart could be affected, your brain could be affected, and so can your eye. So it's a pretty serious disease that's out there that not too many people know about.
Is there a way to prevent it?
No, not really. I should not say that, but if you do have, like, say, a cat bite, I would definitely be checked out by a doctor, and that would also include me because I've been bitten by cats a gazillion times, and I don't think anything of it. Now, knowing what I know, if I get bit, I'm going to certainly go to a doctor immediately. Scratches, I've got various scratches and scars on me. Just soap it up with running water. You should be okay as long as you get that bacteria out.
What about prevention? Starting with your cat, I guess that may go back to preventing the fleas.
Right. Certainly if you get a flea treatment that will take care of the fleas on your cat, that's definitely, one way of doing it. Certainly if you want to bathe your cat to make sure you get all the flea dirt off the cat, that's another great idea to start in terms of prevention.
And again, this is exclusive to cats. Obviously it's called cat scratch disease, but when we talk about fleas, dogs have fleas too. So, but they're not they don't carry this sort of
Right.
same.
They don't carry the same bacteria for some odd reason, and why, to be honest with you, I really don't know.
You have a personal story about cat scratch disease that you're actually familiar with. You share that story. I mean, you're aware of somebody that this happened to.
Yes, actually it happened to my boss, Dr. Staub, where he was bitten by a cat. There's also been a client that has been bitten by a cat, and usually what happened is that they had red streaks going up their arm. With Dr. Staub, he ended up going to see his doctor, and he was putting on antibiotics. Unfortunately, our client did not do that until it was a little bit too late, where she started having horrible headaches, she was feverish, she had red streaks going up her arms, her lymph nodes were swollen, and basically she had to be admitted to the hospital where she was put on IV fluids and antibiotics. So she's doing pretty good now.
As we wrap up talking about canine flu and cat scratch disease, some advice, some reminders to our viewers, just kind of capsulizing the two topics.
Just really be careful and, keep in mind that you do have pets, and that your pets, even though you love them, tremendously, they can come down with various diseases. And if you do, just be smart about it. Certainly consult your local veterinarian, that's one way. Or if you feel like you're having some problems, certainly consult your physician. A lot of people will say if they think they're coming down with cat scratch fever, they'll talk to their veterinarian to see if they do have cat scratch fever. Don't do that. That's kind of silly. Talk to your own physician. If you seem to think that your dog is coming down with canine influenza, definitely consult with your local veterinarian.
And it's important, I think, that you said more than once, don't wait.
Yeah, don't wait.
I think a lot of people think that they might be able to treat it themselves, that they could take care of the problem, but why don't you emphasize that again, that it's probably best if they see these symptoms.
If they definitely see the symptoms. And really quickly, we also had a local veterinarian that recently succumbed to a various form of cat scratch fever. He was also very sick to begin with, but he did lose his life as a result to a cat bite.
Are you able to share that story?
Really quickly, yes. Dr. Marvin Shue, a wonderful veterinarian over in Sealyville, Indiana, had retired last October. And much like veterinarians, probably like me, we don't really know what to do with ourselves in retirement. You just kind of keep working. And there's a theory out there that he was at a local humane shelter, not sure which one, where he was bitten by a cat. And unfortunately, like me, he's probably thinking, oh, I've been bitten by a cat. It's no big deal. I'm Superman and so forth. The biggest difference between, say, Dr. Shue and myself is that I'm relatively young, so to speak, healthy. Dr. Shue had a lot of underlying medical conditions. And the infection raced up through his body where he became septic. He ended up having a stroke, I believe. And while he was recuperating in the nursing home from the stroke, he came down with pneumonia and he passed away. And this was back in December. So if you're thinking that he retired in October and he slipped away from us in December, it's pretty quick and pretty serious.
Well, thank you so much for the information
Thank you.
today. I have a feeling the canine flu will be around for a bit.
For a while, for a
the
bit.
cases have subsided in the Chicago area.
Yes.
And there were a couple of cases in Champaign-Urbana. So
yes.
it is something to all of us should keep an eye on. And again, if your pet shows any symptoms, to make sure that they
Definitely.
get looked at. So Greg Reilly from Honey Creek Animal Hospital, thanks for coming over and joining us
Thank
for
you
this
for having
episode.
us.
Mop it. You want to go home with me or what? You've been really relaxed on my lap.
She'll go home with that
Yeah,
anyway.
so thank you for coming and joining us today. Right, and thank you. We'll see you next time on The Paw Report. Did you know full episodes of The Paw Report are on YouTube? They can be accessed at youtube.com/WEIUTV. Then just go to the Paw Report playlist and select the episode you want to see. More information about the show is also available 24/7 on our website at WEIU.net under the Television tab. Production of The Paw Report is brought to you by
Okaw Vet Clinic in Tuscola and Dr. Sally Foote remind you to properly take care of your pets and are happy to help support the Paw Report on WEIU. Okaw Vet Clinic located at 140 West Sale Street in downtown Tuscola. More information available at okawvetclinic.com.
Dave's Decorating Center is a proud supporter of the Power Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.